joined by, of course, our Health Commissioner, Dr. Gail Burstein from the Erie County Department of Health. And we're here to talk about recent issues and, of course, with regards to whether there was possible exposure of individuals who live in Erie County to coronavirus and then the resulting COVID-19 illness that may result. As was announced earlier today by Governor Cuomo, and as most of you had known, there were 6 individuals who had been tested for possible exposure and whether they had coronavirus, COVID-19, that live in Erie County. There were multiple families that had recently traveled to Italy and returned, and then a number of those individuals, 6 in total, were showing signs of illness. So our Erie County Department of Health staff went out and collected the samples using proper protocols as advised by the CDC. The samples were then driven to the Wadsworth lab in the Albany area, which is the New York State Maine Department of Health lab, in which the tests were performed, and as was announced earlier, they came back negative, which is a good thing, meaning that the individuals did not have anything in the samples that evidence that they had coronavirus and or COVID-19. They may be and probably might still be dealing with a respiratory illness, but it just goes to show that there are other respiratory illnesses out there, and just because you have a respiratory illness does not mean that you have the coronavirus or COVID-19 at this point. So we want people to understand that these 6 individuals were showing some signs symptomatic of what would have been the coronavirus. However, we took the proper precautions. The tests were performed. As I said, samples were collected by the Erie County Department of Health team, were transmitted, actually driven to the Wadsworth lab. The tests were performed by Wadsworth, and we had results as of early this morning, and of course it was first announced by the governor that all tests were negative. I will now turn it over to Dr. Gail Burstein and talk a little bit more about this, and then we'll talk also about precautions we're taking, as well as discussions I had with senior members of President Donald Trump's team while I was in Washington at the White House, in which a good portion of this conversation was in regards to issues associated with the coronavirus, especially considering some of the outbreak that is occurring right now in the Greater Toronto area. With that, Dr. Burstein,
Thank
do you
you.
want to use that, or
Thank you.
did you want to?
Sure.
Yeah.
Thank you. Count for my height. So thanks everybody for coming today. So we just want everybody to understand that the COVID-19 situation is a rapidly evolving situation both in Erie County and in the entire United States and actually globally. And so we are constantly working with healthcare providers in the communities and hospitals to investigate if an individual may be at risk of COVID-19, and then ensuring if they are, that they are quarantined if they have a travel history or an exposure history, and if they meet the criteria clinically, that they get the appropriate testing done. So actually this morning, CDC increased the number of countries that are designated as level 3 high risk. So in addition to China, they're designating Italy, Iran, and South Korea. So we know that President's Week, there were many people off and traveling, and so now we are trying to ensure that all those individuals who went to those areas of high risk, of high concern with CDC are quarantined, and then we'll evaluate them, and if they have clinical symptoms that meet the criteria for testing, then we'll ensure that the appropriate testing is done. So at the federal government is actually not screening individuals at the airport for travel to Iran, South Korea, or Italy. And so if individuals know that they had been traveling to those areas within the past 14 days, we'd really appreciate if they would call us at the health department, 858-7697, and just inform us about their travel, and then we will ask some questions and then advise on the appropriate actions for quarantine for 14 days after the family or those individuals had left the areas of concern. We are hoping that our public health lab will receive the reagents that we need to perform the COVID-19 test here in Erie County. We have been approved, and hopefully those reagents are on their way, and we can get those validated within a couple days after we receive them. So people who are quarantined, those are individuals who have a historical risk factor of exposure to COVID-19. So either through travel history to an area of concern or to a known exposure to a COVID-19 case. So we know that there are no known COVID-19 cases here in Erie County that have been reported. So primarily here, it's basically a travel history. So that doesn't mean that people are infected because they're quarantined. It doesn't mean that they're contagious and able to transmit infection to other people that they're quarantined. It doesn't mean that the people that are living with them in the house where that individual is quarantined to one room or one area are at risk of transmitting illness to others. So what we're trying to do is just keep the public safe until the 14-day incubation period has passed, so that we know that nobody in the community would be at risk of being exposed to an undiagnosed case of COVID-19. So again, people who are quarantined are not dangerous of transmitting infection. However, we want to make sure that they're during this incubation period where their status could turn from negative to positive, that they're not interacting with anybody in the community. And that's one of the strategies that CDC recommends to make sure to prevent widespread disease from coming into our community. Since there is no immunization or no antiviral medication for COVID-19, we really have to rely on what we call non-pharmaceutical interventions, or NPIs, to really help try to prevent COVID-19 from coming to our area, and then when it does, to hopefully keep the levels low and not to have a huge spike in number of cases. And so those are easy things that we can do as individuals, such as making sure that we wash our hands frequently and use soap and running water, and make sure that your hands are under the faucet for a good 20 seconds, and then dry them off with a towel. Remember, we want to try to manually wipe that virus or bacteria or whatever there is off your hands. You want to make sure that you practice good respiratory etiquette. So when you do cough or sneeze, you want to make sure that your cough or sneeze into your arm, not into your hands, or into a tissue, and then discard the tissue and wash your hands. We also want to ensure that we have good social distancing for people that are ill. So if you see somebody who is out, looks like they're ill, they are ill. We still have a lot of influenza in our community. We still have other respiratory viruses in our community circulating, so you want to stay away from them. And if you're ill or your kids are ill, you want to make sure that you stay away from other people. So that means not going to work if you're employed, or not sending your kids to school. Also, just from an environmental standpoint, we really want to make sure that people clean things down, especially objects that are frequently touched. So we know that from the medical literature that the coronavirus can actually survive on surfaces up to 9 days. So we want to make sure that you wash off those surfaces with a good disinfectant, optimally something that has bleach in it. And especially countertops or tabletops, toys, doorknobs, railings, any surfaces that are frequently touched. And then if you do touch those surfaces, you want to make sure that you wash your hands. Don't share utensils. Don't share drinks with straws or cups. You want to make sure that we keep it safe, and hopefully we can postpone the onset of COVID-19 in our area. However, it's as you see, it's in New York State, and it's in southern Ontario. So there's no reason to believe that it eventually, we believe that it will eventually come to our area. So this is an opportunity for us to think, smartly about what we can do to prepare when we do have a community transmission of COVID-19. And so what I mean by that is that there is transmission of COVID-19 virus within the community, and so people are becoming infected from people that they didn't know had COVID-19. They don't have a travel history. They don't have an exposure history. And so there's no known source of the COVID-19. So we just know it's somewhere in the community, they've seen in other areas of the United States. So some things we can do is actually continue washing our hands, staying away from people that are sick, staying home if we're sick, washing surfaces. But also we want to think of some other strategies to implement some widespread social distancing. So that might mean for schools, try to split the classrooms up into smaller size so there aren't these huge fish bowls of kids possibly infecting each other. So break it up into smaller groups. Or in schools, they might need to plan for a planned school dismissal, where the staff stay in the school and hopefully they can continue to send out curriculum to their students and maybe even offer electronic classroom opportunities for students, because they do need to continue to learn. Also, think in the workplace. Think about virtual meetings. Think about people who are able to do their work virtually on a laptop, to allow them to stay home. Especially we're going to have a strain on our workforce when parents have children that are home from school, or people are quarantined for 14 days. They can't go to work. So we have to think about how we're going to adjust our workforce. And again, washing the environment, keeping things clean, and working together. Again, we are all in this together, and we've come out of some very stressful community situations, from public health crises, on the better end. For example, our opioid epidemic. So we've always disclosed when we have something that we feel that information that we feel the community needs to know. If we have a case of COVID-19, we think that you will need to know, especially people who were in situations maybe in a school or a workplace or any type of place where a synagogue or a church that could have been exposed to those individuals. We are going to inform the community because we want people to take the appropriate precautions. So if we listen to the facts, if we look at information from the CDC website or the New York State Department of Health's website or our website or these press announcements, you'll have good information, and you'll know to do the smart thing to keep yourself well, instead of listening to rumor, which could cause people to take actions which could cause harm. So I think we want to take any questions.
First, before we go down there, I want folks to understand, because this is a serious matter, but we thankfully don't have any. We don't have any cases here at this point. That doesn't mean that we're not in a region that does. This is the heat map that is put together by Johns Hopkins, which shows the cases actually throughout the world and the country. And here's just some that, as you see, you got China, huge amounts, Europe, especially with Italy, and in North America, smaller amounts, mostly on the West Coast. But you do see that one. Oops. See if I get this working right. I think I'm too far away. Actually, let me just move over here. You're not looking at me anyway. I clicked on Toronto, and Toronto has 19 confirmed cases of coronavirus, COVID-19, which I know everyone is talking about the downstate cases, but we're 90 miles away, as the crow flies, from 19 cases, the majority of which, our understanding, is because of travel primarily to Iran. And it just goes to show that this was, a few days ago, was 4. So it is increasing in North America. Let's see if I can get a little. I got to go back. Hang on. You see no red dots in Erie, Pennsylvania, Cleveland, Detroit, Syracuse, Rochester, and thankfully Buffalo, but you do see a big red dot in Toronto. And then, of course, there's a couple of cases that were announced by the governor downstate, individuals who had recently traveled abroad. And we just want folks to understand that this is a serious situation that we're taking extreme caution with. When I was down in Washington, D.C., a number of New York representatives were meeting with high-level ranking officials in the Trump administration. 2 days ago, we spent almost an hour and a half talking on a number of issues, one of which was, of course, the Trusted Traveler Program. But Trusted Traveler Program is it has an impact with coronavirus, because if we are having slowdowns at the bridge associated with the Trusted Traveler Program, there's anticipated slowdowns which will even be greater at all the recent border or local border crossings associated with if it grows to a much greater degree in the Toronto area itself. So I want folks to understand that we are taking this seriously in Erie County through the Erie County Department of Health and my administration. We are in touch with federal representatives, state representatives. The meeting I had was with some high-level individuals with the Department of Health and Human Services, as well as the Director of National Response for the National Security Council, Jeffrey Rabini. So this was not low-level individuals from the Trump administration that we were meeting with. They are concerned, and I think you can see the concern from the descriptions from the president, as well as him impaneling this task force that is headed up by the vice president. I do believe that there's good levels of communication going on between the federal, state, and local governments, and that's important because when you have a situation like this where there's a lot of fear out there, you want accurate information being distributed to the public, and we are distributing accurate information. We want the public to understand, as in the doc, when we were talking about it last week, especially when there was multiple false posts that were being put on social media, that we were lying and that there were actual cases here in Erie County, and the answer is no. We want people to understand the role of the Department of Health is to protect the public's health, not to lie to the public. We, as the doc noted, whenever we have a situation, whether it's hepatitis A or the opiate epidemic, we talk about it so the public understands the issues that we're dealing with and the public has to deal with. And I want the public to feel the same way with regards to this too. We have incredible professionals in the Erie County Department of Health. As the doc noted, we expect to be receiving very shortly the reagents that will allow us to do the test for determine coronavirus COVID-19. There are very few public health labs that are going to have that opportunity to do that, at least in New York State, and we are one of them because of the incredible staff that we have here and the work that they do. So it just goes to show that we have a great team in our Department of Health. I just took a tour, actually, as I do occasionally, of our public health lab because we had just finished some work there, just infrastructure work, new rooms and stuff like that, ceilings. We did a lot of work there. So I took a tour to check it and met with the folks, and they're willing to do whatever it takes to ensure that we protect the public's health, and we're ready to perform those tests if we need to do it. Right now we don't have the reagents, but as soon as we will, if there are additional needs for it, we will perform those tests. We will not have to send it to Albany, which will save some time as well. And with that, we will now open it up to questions.
Are we looking at days or weeks before that lab would come here to Erie County?
Well, the lab is here. It's having the...
You mean the test?
Yes.
Yeah, well, so CDC, oh, thanks. Thanks.
Gonna have to get some WD-40 and...
So CDC has approved Erie County Department of Health Public Health Lab to do the testing and receive those new reagents. So I think that they're on their way from Albany, or they should be soon. And then after we receive them, it'll maybe take a couple days to validate the tests, and then we'll be available to be able to do those tests.
So somebody reagent, I'm sorry, but the reagent.
The
is that
chemicals.
The virus or chemicals?
The chemicals that are needed to do the test.
Okay.
It's a real-time reverse transcriptase PCR test, and so there needs to be several chemicals and reagents to be able to do that test. So the turnaround time for the test is about 6 hours. So the advantage is that we won't have to add an additional 4 or 5 hours to drive the specimens to Albany. We'll be able to do that right here and have a same-day turnaround time for people who meet the criteria for testing.
The governor referred to them as test kits. Is that essentially what we're talking about here?
Right, they come in,
kits?
in packages of test kits, and we need to have specific reagents for them to be able to perform them.
If there is a confirmed case of coronavirus here, could you walk us through the immediate process that would happen with that person? Would they still be at a hospital? Would they be sent home and quarantined there? What's that immediate process?
Well, that individual would definitely be put in isolation, and depending on their severity of illness would really dictate where they remain in isolation. So if it's somebody who is very ill and requires hospitalization, they will be hospitalized in a negative pressure room and in a hospital. If they are not very ill, just have mild URI symptoms or no symptoms at all, they can stay isolated at home. And so then we would initiate our investigation. And this is an investigation that we do with any type of reportable communicable disease. So we get a thorough history of that cases, like whereabouts and where they've been in the past 14 days. And then we would try to get if there are any known contacts, especially those in the home, we would collect those names. If that individual has gone to mass gatherings, we would need that information, and then we would do what we say contact tracing and notification. So all those individuals that were exposed, we would want them to remain in quarantine because they're probably not ill, and wherever they can in their home or some designated area for 14 days after their last exposure. So if they were in a mass gathering, like a school, then we'd have to start to have a discussion about possibly closing the school. If they were in, say, a place of worship, then we would have a conversation with that place, and they would help us figure out who was at those particular services or events, like a wedding, and then to hopefully be able to notify them, and so they can take the right precautions and be quarantined for 14 days. And then if somebody is ill who was exposed and meets the criteria for testing, then we would be able to test them.
I think it's very similar to, okay,
I'm good.
no injuries. It's very similar to what you see right now in Westchester County with the one individual who was identified as actually having the virus and had attended two services at a temple, at a synagogue, and now all the individuals who attended those services are being asked to be self-quarantined to determine that they don't have it. We theoretically could be in a similar situation if we did have a case here. We don't right now. That's the important thing. We'd have to look at every situation and follow the standards from the CDC as well as the New York State Department of Health. And if it required notifying others that there's a possibility that they were exposed to an individual who has coronavirus, then we would notify them. We would not hide that information from the public, just as they're doing right now in Westchester County. Eileen, you had a question.
Well, Commissioner, even without a case here, excuse me, were you able to notify schools? Like these families that came back that were tested, are the schools being notified? There's so much concern out there, and again, a lot of social media going around, hearing that, students from Amherst High School came back from Italy, 9 of them. There's so much concern with the school community and what the schools are being able to say and not say.
Right. So once again, we currently do not have any cases of COVID-19 here in Erie County. There have been people who traveled to areas of high concern designated by CDC, and those individuals need to be quarantined. It's not because we know that they're contagious, just we want to make sure that they, in case they do become infected and could become contagious, we want to make sure that they stay away from the rest of the community to keep the rest of the community safe. So the only reason a school district may need to know is so we can the student would have an excuse for being out for school for an extended period of time. However, as of now, no other students in the classrooms where where individuals who are quarantined might attend school are at risk of any type of exposure because we don't have any COVID-19 here in Erie County.
Well, how
But
many
you know that
people
those
are?
students- But you know that those students when they got back here that they never entered a classroom. I think that's where people are concerned, like, what exposure did they have on the way back? You know, did they go back to school? Did the families go back to work before they were tested?
Well, we, again, we're following people under quarantine who are not eligible for testing because they don't meet the criteria. So that's probably most of the people who are under quarantine right now have not been tested because they don't meet the testing criteria. Again, we don't feel that if we are suspicious that somebody has a COVID-19 virus, we will test them. Right now, what we're trying to do is remove those individuals who could be at risk of developing a COVID-19 infection because of their travel history away from the rest of the community to protect the rest of the community. We don't have any evidence now that those individuals are infected, especially now that we have test results that are negative on some of them. And we were just taking this, out of precaution. Again, this is one of the non-pharmaceutical interventions that we can take to try to remove people who may be at risk of developing COVID-19, away from the rest of the community. But again, we have no evidence that there is any transmission here in our community. And again, it's these are the CDC designated protocols. So even when people were coming in from China, many times if they're asymptomatic, they were allowed to travel to their final destination. And again, we're not considering them contagious right now. We just want to make sure that they stay away from the rest of the community in case they do become contagious.
Well,
David?
how many, thank you. Roughly how many people in Erie County right now?
Again, I'm
being
not allowed
self-quarantined?
to. Yeah, I'm not allowed to discuss individual cases. I can tell you that we are following CDC guidelines, and when somebody is quarantined, it's not just a matter of staying in their, wherever they are, locked up for 14 days. We really want to monitor them on a daily basis to ensure they don't develop any signs or symptoms of infection. So what we do is when we deliver the voluntary quarantine orders, we explain, what quarantine means and how they need to restrict their travel within the house. If stay in one bedroom, use their own private bathroom, had food delivered to their room, and nobody comes in and out. We have them keep a travel log in case somebody does come in and out, but we strongly discourage that. And we give them a thermometer and ask them to keep a temperature log and to take their temperature twice daily. And then we check in with them at least once a day, and we ask them to take a picture of their temperature log and send it to us so we can see that. And we ask them about how they're feeling to see if they're developing any signs or symptoms that could be consistent with COVID-19. And again, we're going to do that for 14, throughout the quarantine period, which is 14 days after they leave the area of risk.
All right. Roughly how many people are
You-
under those conditions? I'm not asking you to comment on individual cases. You explained you can't do that. What I'm looking for is for you to be able to tell people how many people does that involve right now?
Again, I can't discuss individual cases. I don't want to put anybody at risk of having their information disclosed. So and again, this is a rapidly evolving situation. The number of people under quarantine today is not going to be the same as the number of quarantine people tomorrow or the next day. Just rest assured that just the community should feel reassured that we are working with our local healthcare provider partners and with the community to ensure that people who have a potential risk of exposure because of travel or because of a known close contact for somebody who has COVID-19, which fortunately we're not seeing here yet in Erie County, are being appropriately quarantined and removed from potentially exposing other people in the community.
Doctor, we're not looking
That-
for
that-
names or
Chris?
addresses here. I mean, we're not looking for individual names or addresses here. We're just trying to get a number. I mean,
Right.
Are we
Well, it's
talking
just-
dozens? Are we talking hundreds?
Well, again, we really don't want to disclose any information that could, potentially, disclose who those people in quarantine are. So
How would that disclose? How would that disclose who the people are?
The state violated the law, and we've been told that we can't, we've been told that what they did was wrong, and we can't violate ourselves.
In what way did the
I
state
would-
violate the law? What,
in revealing the location of individuals that were subject to a test.
Yeah, it's a big.
I understand it's a big place. I know it's a big place. The individuals, as described, how's the best way to put this? There was a fear that the individuals may have had the virus, and there was a fear in this community that these individuals already had the virus. That's why we immediately acted to have the tests done, to have the samples collected, and to transmit those to the state for the actual test to be performed. Not every individual who traveled, as you know, because there were at least, I think, 12 individuals who traveled, had a test done because they were not showing any signs whatsoever of an illness. It was only those who were symptomatic, and those were 6. The governor announced that. If you follow the law, as we've been told by the CDC and the Fed and the state, we're not supposed to say that, but the governor announced it. So what I want people to understand is this is not the first test we've had done in our community. There were Chinese students at the University of Buffalo who had just recently returned and were put into quarantine. And I do believe there was at least 1 and possibly 2 tests that were sampled and sent down to the CDC in Atlanta, which was determined that they did not have the virus. That's why I want people to understand there are going to be additional incidences of this. If you have a trip planned to go to Italy, I would cancel it, postpone it. It's right now.
So you have to be quarantined for
14 days when you come back, regardless of whether you're healthy or not. If you're going to South Korea for business, cancel it. There's all kinds of things that have been going out there. I mean, when we were in Washington, there was discussions about the Olympics being postponed because there have been cases, as I showed in there, in Japan and what's going on in China and South Korea. And there's a thought, do we really want to hold the Olympics and bring everybody from the world together so that they can go back home to their home countries and potentially spread the virus? So
can I just understand, I want to make sure I understand you correctly, there have been people who have been being tested without the public being informed about that testing?
it's like any other test that's protected by HIPAA. If there are other contagious diseases we've had to deal with in the past, swine flu, H1N1, in which the tests are performed, but the public was not immediately advised that an individual in the community was being tested for that, because it's prohibited under HIPAA. I'm an attorney. I want to ensure that we do everything to follow the law, but also provide accurate information to the public. And that's what we've been doing, is providing accurate information to the public. We immediately acted to ensure that when it was questionable whether there were individuals who, because of their travel history, recent travel history, I should say, as well as showing some signs of what appeared to be an illness, or a respiratory illness, that samples were taken. Those were immediately driven down the thruway to Wadsworth. They were tested, and we had the results this morning. I don't want people to think that we're ignoring this, because we're not. But as was explained to me in Washington, D.C., there are probably people in the United States right now who are walking around with a mild respiratory issue, not thinking that they have the coronavirus, and they probably have it. And most people will recover. And the one thing that's shown is there's 94,250 confirmed cases in the world, and 51,000 of them have recovered. And many of them won't even realize they have it. They may have the sniffles. They may have something that they think is just a common cold. And we'll never know about those individuals unless they go to a primary care physician and they get tested. We may never find out that they actually had the virus. And I want people to understand that we're not trying to hide something. It's just this type of virus is such that there are people in the world, if there are 94,000 confirmed cases and 51,000 of them have recovered, the expectation is the confirmed cases, or the actual cases, are much more than the confirmed cases. We may never know exactly who has the cases in total. If somebody shows the signs and they've traveled to the areas where there is significant risk, then we will do what is necessary to protect them. That's why I want folks to understand. We're 90 miles away from at least 19 confirmed cases of COVID-19. And 2 of the individuals have recovered, and thankfully there have been no deaths. But this is not something that's just happening elsewhere. And there may be people in our community right now who have it because they've been exposed through either travel or through community spread. that we may never find out because they're never sick enough to think about, I got to go get checked for this.
But also, we just want to point out that when we will tell you if we do have a positive case, because that's something that you need to know
Yes.
to protect yourself. However, if we have tests that are done and those tests are negative, there's nothing that the public needs to know to protect themselves. It's just business as usual.
But you do tell the public how many people you test for influenza. You put that information right on your website. We're basically asking for the same information with respect to coronavirus. Why would it be any different?
Again, because that's thousands and thousands of tests. I mean, we're not at that level.
The state reveals that information.
Right. I mean, and whoever reveals it, it's like a huge number. There are thousands and thousands of people that are tested for influenza, and so so that with that large number, you may, it'd be hard to figure out who that was. With the small numbers that we have, again, there's a potential risk of exposing confidential, personal health information, and so we're not disclosing who's tested. We are disclosing who is positive, and we are disclosing information that it would be relevant to the community in terms of protecting themselves against exposure themselves from contact.
So while you do put out numbers on your website of how many people have influenza, you can't put out a number of how many people are under quarantine.
We will put on information about how many people have COVID-19 when that test is positive, just like we put out information about positive influenza tests.
Can I just follow up on that? When you say quarantine, of course, that conjures up all sorts of thoughts in people's minds. But if somebody has recently traveled and they call you and notify you and find out and you advise them however you were, when it comes to quarantine in your home, I mean, is that voluntary, Dr. Burstein, or is there a section of the law that makes it mandatory?
Well, it's voluntary if you agree and you sign the agreement to follow the rules of quarantine. If an individual refuses to sign and refuses to comply with our recommendations, I have legal authority, which I have exercised, to mandate people to stay in quarantine and follow those rules. And what we would do if we have to issue a commissioner order, is what we call them, somebody from the health department would deliver that order, accompanied by somebody from the sheriff's office, an officer from the sheriff's office, because it really now is a legal interaction. If the person does violate the commissioner's orders, they are subject to prosecution.
And so you would do bed checks or something like that?
Well, what we would do is the same thing as a voluntary order. So we would give them what they need to do, and just in terms of their travel, their activities. We give them information about that. We also, and we try to explain that to them if they'll speak with us. We also give them a thermometer and a log to take their temperature and record that. And then we will call them at least twice a day. If we have any reason to suspect they are going out or letting people in, we will do a site visit with one of our Erie County sheriffs to investigate.
If an individual is refusing and a commission order has been issued, that includes the power to have a law enforcement official stationed outside to ensure the person doesn't leave. We hope we don't ever have to get to that point, but that is not a new law. That actually is an old law that's been in effect for quite some time, that we thankfully haven't had to use recently. But if it got to a point where there was a pandemic in the community and we felt that individuals were ignoring orders, we could, actually I can't, she can. I like to joke she's actually the most powerful person in Erie County because she can quarantine each and every one of us through written order.
Behave.
So, and
I imagine that might more come into play if you had like a confirmed case.
yes.
Well, that's
And
when,
go
right.
ahead, Doc.
But if somebody,
Well, no, it would be any
And
time.
somebody that's confirmed and they step out for a sandwich because they're
Or-
No, even if they're
They don't
not
have to be
confirmed. If we determine that they need to remain in quarantine for a certain period of time, they can do it voluntarily, or they can do it involuntarily. There is an opportunity for them to go through due process to challenge this in court, and we have met with our 8th district courts to just to ensure that we're all on the same page with that, and we have a plan to conduct those hearings if that needs to happen. That has not need to happen yet. However, this could turn into a legal mandate with legal consequences, and our again, the sheriff's office is well aware of what their responsibilities are.
And that's all part of our planning, as I've been saying for some time now. We were putting into place the plans that we have already in existence for a global pandemic or a regional pandemic, because we've always known that something like this could happen, whether it was going to be a coronavirus or something else, H1N1, SARS, you name it. But we have these plans already in place, and one of the discussions we had when it appeared that this was a serious matter and it was going to affect the United States was, okay, what do we need to do to ensure that we're best protecting the public? And that is on both the public health side as well as what do we need to do legally to ensure that we're best protecting the public. I'm hopeful that we never get to a situation where we have to force a quarantine on an individual and have a guard stationed outside the house to ensure that that person is not a potential risk to the community. But by God, if we have to, we will.
Doctor, one of the things that the governor's office has said back-to-back days now is we don't want people to just be afraid. Maybe somebody sneezes on them and they're so afraid that they feel the need to get tested. Basically, we don't want to run on emergency rooms. So can you speak to people and tell them, I mean, here's the situation where you should get tested and you maybe should go to the emergency room.
Right. So the criteria are for testing is an individual that, first of all, they have to have a known potential exposure. So either through travel to an area that is designated as a high-risk concern by CDC, or a known exposure to a COVID-19 case. And then they have to meet the clinical criteria. So they have to have, depending on their type of exposure, varying level of respiratory symptoms. There's also one category where you don't necessarily need to have a known exposure, and those are people who are very, very, very ill, like, for example, in the intensive care unit, and we can't determine any other possible cause of illness, and so then we could do a test. But however, so the individuals, again, they can read that information on the New York State Health Department's website. They can read that information on CDC's website. If they have questions, they can call their healthcare provider. If they think that they have the history of potential exposure through travel or through a known contact, before they go to their healthcare provider, the emergency department, they should call them, let them know they're coming, and so that they can take the appropriate precautions with personal protective equipment, and put the person in an isolation room or a negative pressure room if one is available, to make sure that the rest of the people in the healthcare facility are protected. So again, we don't expect that we will have many COVID-19 tests needed to be done, especially right now. However, if people do meet the criteria, today we can send them off to the New York State Health Department, and hopefully by next week we'll be able to perform them in-house here in Erie County in our public health lab. But again, it's not a common cold. It's a spectrum of combination of history and clinical evaluation. And so with people who get sneezed on or coughed on are much more likely to be exposed to, say, influenza or maybe one of the other coronaviruses or like paraflu or the other respiratory viruses in our community.
Will any of the SUNY students mandated to return from trips abroad to some of those higher risk countries be quarantined in Erie County? And if so, what would be the health department's role in helping manage?
Yes, so if they meet the criteria for quarantine, so within 14 days of departure from one of the CDC designated areas of high concern, of high risk, we will ensure that they are quarantined for those 14 days. I'm not sure if the students are going to return home or they're going to return on campus. We have a great relationship with all our higher education facilities here in Erie County, and we can work with them to make sure that the person is appropriately quarantined, and they get what they need in terms of food and laundry.
Well,
The
it
state-
said today
Yeah,
that
the
they
state
were.
is-
Right,
Yeah.
right.
They were picking,
In
they were
Western
trying
New
to
York.
find sites. I think they have one in Western New York for those SUNY students from Western New York, so they're not staying down in Rockland County or whatever. Have you helped coordinate, if they asked you to help pick a site or anything like that? Or
Well,
they handle
if
it?
they, I think, UB has, in my experience, has a lot of housing here, so you can ask them how they're approaching finding a site. If they ask us to help, we are always willing to help them.
And going off of that, is the county concerned in any way that there is now going to be these people coming in from the highest risk coronavirus countries into Western New York? Is that a public health concern or no?
It is a public health concern. That's why they will be quarantined for 14 days and not exposing themselves to the rest of the community.
But why not keep them over there in those countries until they
That's
get
not our
their-
call.
But, and
That's
also
not our
they could be-
decision, and they're U.S. citizens. They could return to the United States at any time. We can't, by law, my understanding is they can return. They will be put into the quarantine, but these are U.S. citizens, and they have a right to return. We just have to ensure that they're not going to infect the general public, and those are the actions that are being taken by the state to ensure that. Sandra?
So can you clarify, you had said that there were UB students who had traveled to China and come back, and that you guys actually sent test results to the CDC to be tested, and those ended up being negative? Are those the only other people who have left Erie County and come back and had test results that had samples taken that needed to be tested?
That I'm aware of, yes.
So how many students was that if they've tested negative?
Well, again, we don't want to disclose any personal information for anybody.
Well, what do you disclose?
All of them, I'm disclosing that fortunately, all the tests were negative, and so people don't have to worry about having been exposed to COVID-19 from anybody, as we know of right now in Erie County.
But
I
they
don't-
tested negative.
I don't
So-
know the exact number.
Do-
But
do you-
everyone that has been, every test that was performed, and once again, these individuals, a test was performed because they just returned from China, which of course now is on the do not travel list, just like Iran, just like a good portion of Italy. I think there's, in South Korea, there are some recommended not to travel lists. They're not on the do not travel list yet. And of course, if you're paying attention to what some major world corporations are doing, they're starting to cut back on travel among their individuals because they're afraid of the impact it'll have. As I said, there are individuals we're aware of that had just returned, and therefore they were quarantined or a test if they showed any signs of illness, a very small amount. However, the one that was sort of came out because it was announced by the state was the one with regards to yesterday and the individuals who had returned to Italy. I just found out about that myself, I think 12:10 a.m. On yesterday morning. It's not like this is something that was out there for days and days that we were hiding. We just found out about it as a county within the last 36 hours, and since then, the tests were performed, the samples were collected, the tests were performed, and we got the results back this morning saying they were negative, and they were announced by the governor.
But even if you had found out at any point, you wouldn't have disclosed it by what you're saying. So it sounds like
Yes.
it is the state that is actually being more transparent in regards to this than.
Right. I mean, we would disclose information about a positive test because that would put the public potentially at risk, and we would ask the
Yes.
public to do something different than they normally would if they compared to they haven't been exposed. With a negative test result, there's really nothing people need to do differently in the public to protect themselves other than what I recommended with the non-pharmaceutical intervention. So again, we are informing the public of what they need to know to keep themselves healthy against and hopefully protect from exposure from COVID-19.
And-
That's the information we really want to share to keep people healthy in our community.
And the other thing to remember is if you're worried about deaths associated with a respiratory illness, there are more people that have died that we know of in the United States from the flu than have died worldwide with regard to COVID-19. Last I saw, there were 18,000 suspected flu deaths in the United States for this flu season, and there's 3,214. Now, that means that we're not taking seriously COVID-19, but we want people to understand that there are other illnesses out there that you need to take seriously. We also recommend you get a flu shot. We don't get records of every individual who has been tested for the flu if it's negative. And so it's not like we're reporting that today 725 Erie County residents are being tested for the flu and we'll give you the results on whether they have it or not tomorrow. We don't do that. And so I want people to understand we're treating this the same as we do. If there was a positive test result, then we would take it to the next level, which is, yes, we do have a positive test result in Erie County, and here are the actions that are being taken associated with that individual to protect the rest of the public.
So where did the state violate the law? By saying that there were positives or saying that the people in Buffalo tested?
Not so much in the positives, but probably in that they were testing a certain number of individuals. They never did that, and I'll say this, they've tested other individuals to my understanding in New York. They haven't told us the number, but we do know that. They never released that to the public until it was said yesterday at a press conference.
All right. Do you have to be tested more than once, or are you good to go after you've one test to be requested?
Really, I mean, we take it by case situation. So if there may be a clinical course that may warrant repeat testing. Again, the incubation period can last as up to 14 days. So if a person tests negative at a point in time, it doesn't mean that in further on during that 14-day time period that they could convert to positive. The test, the real-time reverse transcriptase PCR test or polymerase chain reaction test is very, very sensitive. That's why we were fortunate enough to have this available in the United States and soon in Erie County. I mean, we use this for other infections. But there needs to be enough of a detectable burden of virus for be able to show up on a test.
And one more about animals. Can pets get this and transmit it pet to pet or to people? Do we know anything about that?
I'm not aware of that. There's probably research done. I'm trying to focus on keeping our community safe with human transmission. And I guess if we start to get widespread transmission with individuals, we'll have to look at other vectors of infection.
Dr. Burstein, are you going to Albany tomorrow? And what are you expecting to get out of that meeting?
Yes, I am going to Albany with leads in my disease epidemiology and surveillance and my lead in our public health preparedness. And we will meet with leadership at the New York State Department of Health, receive a situation update, and also receive information about new recommendations and guidance that the state has and is developing.
Do you think something like that is worth an actual meeting in Albany? You were talking earlier about video conferences. Can we do that with this?
It's actually a state law that because the governor declared an emergency that there needs to be an in-person meeting. So we're just following the law.
So this has happened a couple times before, right?
It may have happened. It's not happened in my tenure.
How are you handling the immigrant and refugee population and getting messages out to them as well?
So that is a challenge to communicating around any health risks for individuals where English is their second language. We are working hard with our community partners to get all the information that we can translated into the most commonly used languages here in Erie County. Also, we have great partners with our community healthcare providers that also help us with translation and communication to those populations. So we are very focused on that.
What about travel to New York City? Now that it seems like there's a start of an outbreak in that region, there's a lot of people that go back and forth weekly to New York City from this region, not to mention if you fly anywhere out of Buffalo, there's a good chance you're going to hub in Newark or JFK. Are we worried about people going into the region as often as they do from Buffalo?
Well, again, there is right now the risk in the United States is considered to be low. CDC is designating it as low. And so people have to decide what level of risk they're willing to take with travel and exposure, and then they may need to modify their activities accordingly.
All right. if there's no further questions, we do want to talk about one thing on opiates.
Yes, so I have, yes. Yes.
What extra precautions, if any, should nursing homes or assisted living facilities be taking at this point? If any, obviously, if the outbreak out at the Washington nursing home, what extra precautions should nursing homes do at this point?
Well, actually, there is some very clear guidance both on the New York State Department of Health's website and on I believe there's some information on the CDC's website also for long-term healthcare facilities such as nursing homes. And, again, it's, what we, kind of the general broad strokes of what we recommend, good hand washing, good and, environmental cleaning, good use of personal protective equipment with someone who is ill. So those are, all things that these long-term facilities can do. And I know that the New York State Department of Health actually is the enforcement arm for those type of facilities. And I believe they are having communications with them, just like the New York State Department of Education is having communications with our, educational entities. And I have to say that on Friday, I'm actually going to a superintendent's meeting here in Erie County just to reinforce those messages with our superintendents. And then, and then I just, one more thing. So I know that in the past couple years, we have done a great job working together as a community to bend the curve with just in terms of the number of opioid-related deaths. However, in the past 3 days, from March 1st through March 3rd so far, we have been reported 7 suspected opioid-related overdose deaths. So that's a very large number, much larger than we've seen in the past couple years. We sent on the Central Police Services Crime Lab hasn't really picked up anything unusual. We've been working with them. Law enforcement hasn't really seen anything unusual. Our toxicology results tests are still being done, so we don't know specifically what the cause of these overdoses are. We just want the community to be alert, and if people are using substances on the street, even if they think they're using a substance that is not an opioid, like cocaine, we know from the Central Police Services Crime Lab that everything is spiked with fentanyl in it now. Cocaine, cannabis, hash, meth. I mean, there's nothing that is just safe or is definitely free of fentanyl. Counterfeit pills. So it's important that individuals have what they need on hand to protect themselves against an opioid-related overdose death, and that is basically naloxone. And we're recommending using Narcan. It's already a self-assembled nasal spray. You need a prescription to purchase that in New York State, and also the New York State Health Department has a program with called. A program where if people use their insurance to purchase Narcan, they can be reimbursed up to $40 a year in co-payments. It's called NCAP. It's Narcan Community Access Program. Also, if people, for whatever reason, can't afford to purchase the naloxone themselves, they can come to one of our Erie County Health Department Narcan trainings, and for those individuals who otherwise don't have a source, we will give them a dose of Narcan. Again, still we're training all our first responders. We're equipping all our first responders with doses of Narcan and refilling them when they use it. So this problem, even though we've been quiet about it, it's we never know that it's completely gone, and so that's why we just want to alert Erie County residents and Western New York residents that there's something out there that is killing people, and we just want you to be aware and prepared. If people do use something, try to use like a test dose, like a really, really small dose, just to see the effects on an individual before they take the full dose. Also, if individuals are interested in discontinuing or getting treated for their opioid use disorder, they can call our addictions hotline at 716-831-7007. They can go and get an appointment as well as information. They can go to pretty much any of our emergency departments here in Erie County and work with a program called Buffalo Matters. to get a quick evaluation and get a week's supply of a dose of low-dose Suboxone and an appointment for their first visit with a substance use treatment provider for them to continue their care and linkage to a peer and a dose of Narcan. So there are resources available for people who are still struggling with opioid use disorder.
And if I can just finish here, the hotline is for any addiction, 831-7007. We do know from previous toxicology reports that there are individuals who died that had fentanyl in their system and cocaine. So it's quite possible that individuals who are, I don't have an opiate addiction, and I just casually use cocaine, which unfortunately is a recreational drug to some individuals. Excuse me? Thanks. Cocaine for some people, they think, hey, it's a recreational drug, it's a fun drug. We know that there's individuals who've died in not just Erie County, but across the United States because there seems to be a greater spiking of cocaine with fentanyl. And if you are engaging in that practice, which I do not recommend, it is illegal, you could kill yourself, not just from an overdose of cocaine, but because there's fentanyl in there. We don't know the results with regards to the recent individuals who died, but we've seen a spike, which we hadn't seen in a while, and over the last year we have seen repeated cases with the toxicology reports that show individuals have overdosed and died with an opiate in their system, primarily fentanyl, but at the same time they also had other drugs like cocaine. With that, thanks everyone.